Carl.
Thank you, Karen.
Happy to be here today. Well, actually honored to be able to conduct an interview as a part of a series that Vic Schoenbach is putting together of various faculty members of our department over the years. So I was wondering if you could start off and just talk to us a little bit about your early years, where you were born, and where you went to.
I was born in Milwaukee, Wisconsin, and I really was there until about age 18 or 19. After my first year of university, I actually entered the Jesuit order, the Society of Jesus, and I got my undergraduate education with the Jesuits in the seminary, and I went through that 4 years and then a couple years of philosophy. And then at some point I decided, well, this life of not having a family is not for me. So I decided to leave them, and I went to medical school in Milwaukee, Wisconsin, at Marquette University School of Medicine. Finished there in about 1962, and then I went to Michigan, University of Michigan, Ann Arbor, to take an internship and one-year residency. And when I was in my internship, my first year, I was on a service that was taking care of adult leukemic patients. That was 1962-63. And at that time, we weren't very good at finding anything that would help adult leukemic patients, patients with leukemia of various sorts. And after actually spending 2 months on that service, they rotated me into pathology. So we went down to the pathology lab and we were doing autopsies. I started doing autopsies with the resident on patients who I had been working on the leukemia service. And this struck me. I was saying to myself, you know, there must be a better way to handle the disease than by treating the incurable. So I said, where is it, I said to a pathology resident, where is it that they study how to prevent disease rather than how to treat uncurable disease? He said, oh, they do that over there next door in the School of Public Health. And I read a little bit about preventive medicine at that time, and it seemed attractive. So I went next door to the School of Public Health one day and I said, I'm interested in learning how you study and work to prevent disease. And I said, oh, they do that down the hall in epidemiology. So I went down the hall in epidemiology, and they said, yeah, you're in. Actually, I had to go one more year to my first year residency in internal medicine. But I was accepted, you know, about 18 months before I got into the School of Public Health. So indeed, in the School of Public Health, I did learn a lot about preventing disease and studying disease and the like. So that was a choice I never regretted. I'm so happy that I ended up in epidemiology and public health. Epidemiology is, after all, one of the sciences of public health.
Well, of course, we're really glad that you ended up in epidemiology also. But what years were these? Can you?
Okay, so I entered the School of Public Health in 1964, and I finished in 1967 and got a doctorate in, at that time they gave only doctorate in public health, a DRPH, and I got it in epidemiology. And I'd always been interested in lung disease and pulmonary medicine, so I did my dissertation on a study of the Tecumseh study of cardiovascular and pulmonary health, and I studied what it is that affects people's lung function. What are the determinants of lung function? Of course, smoking, we know, but you know, I found other things like the stronger a person's hand grip, the stronger their pulmonary function was. You know, that was a surprise finding. And so that was my dissertation, well-known determinants of lung function in people. And since I was interested in lung function, my advisor contacted the people in Cincinnati who were working on air pollution. At that time, it wasn't, EPA was not yet formed. There was the National Air Pollution Control Association. So I went down there and interviewed with them, and they were interested, I was interested. So I started my career with the predecessor of EPA, and then they became the EPA, and we moved lock, stock, and barrel. Our whole organization moved from Cincinnati here to North Carolina to Research Triangle Park.
What year was that?
That was 1968. Well, when I got here, I still was interested in school public health, so I asked at that time John Castle about the possibility of being an adjunct, a teacher in the School of Public Health, and they said yes, and I liked it. So after about 5 or 6 years with EPA, I came over and joined the university. While I was at EPA, but I continued to do a lot of research on air pollution. We actually had a whole network of studies around the country comparing children and adults who lived in, like, New York area. We had people who were in a more polluted area, people who were in an intermediate polluted area, and people who were in a relatively clean area way out on Long Island. And we compared the three communities in terms of the children's lung function, respiratory disease among adults. And we were doing studies like that around the country, actually, Salt Lake City, other parts of North Carolina. We had some studies in California. So that was inspiring, interesting, but I missed the idea of teaching. And so that's why I came to the university. And I came here and started in 1974, the beginning of 1974. When I got here, John Castle was chair of the department. Some of the other people were here were Al Tyroller, Cecil Sloan, let's see, Barbara Holka was here, Bert Kaplan was here. Several others who were here just a year or two, and then they left while I was here.
Michelle Abram?
And Michelle Abram was here, yeah. I think about 2 or 3 years after I was here, John Castle, got very sick with his cancer and he died. So Michelle Abraham became chair.
John Castle was on leave for a year also,
Yeah,
I think
he
before
was.
then.
Yes.
So when you came in '74, did you get a chance to work with him at all?
Yes, for at least a year
Mm-hmm.
or 2 weeks.
Because he passed away in '76,
Yeah,
and I think '75 he was, well, of course, these should be academic years, so.
at least 1 year he was here. We used to have meetings at his house with the faculty. Like there were only
Wow.
about 15 of us, 10 or 15
Wow.
at that time. But maybe once a month or once every 2 months, we used to go and have meetings at the house. It was very, very nice, informal, pleasant get-togethers.
Could you say anything more about them? That's the first I've heard of these.
Well, we just talked about where the department could go, what are some promising areas of research, what are some possibilities for following up to get some support for research, There were ways to bring the faculty together. We also used to have, at that time, faculty retreats, but you still have those now, so that's nothing new.
And did you get to meet John's family?
Just his wife, through the meetings at his house.
Because he had 3 daughters, I think. Is that right? They had 3 daughters?
Yeah. Yeah, I did not get to know them. No. And yeah, it was a really small department at that time, relatively, compared, especially now. I think we had as many students as you have faculty.
I was going to say, how many students were there then? Do you remember?
Maybe 40, 50, something like that.
It's actually more than I would have thought.
And the doctoral student program was not nearly as large.
What were the students like? What kinds of students did you have back then?
Well, we had more people who were getting masters in public health, some physicians, and a number of non-physicians. We also had a fairly strong program in social epidemiology. Bert Kaplan and yourself.
Well, I wasn't here till 77, actually.
1970.
And then I was only a student, so.
One of the star postdocs who came to our department was a fellow named Gerardo Heiss. He came here, I think, about a year after I got here. And he came from Chile. I think at that time there was quite a bit of unrest in Chile.
Yeah, I interviewed Gerardo also, though it was just an audio interview, but I'll send you a link to that sometime if you like. And Tony McMichael, was he here then?
You know, I cannot remember that.
Because I thought he was a visiting scientist here at some point, but I don't remember where, when exactly.
Yeah, I have forgotten about Tony. I knew him very well, but I don't remember just how he happened to be associated with us here.
And also another one of the environmental epidemiologists, I'm blocking on his name, who went out to California for years.
Alan Smith was here
Alan
for a
Smith.
while. Yes.
Do you remember about when?
That was about 1980, I would think. Yeah.
So that was later.
He came here from New Zealand.
Oh, like Neil Pierce.
And then
Was Neil here also?
Neil Pierce was here as a postdoc for about a year or two. Yeah.
This was quite a place.
So, well, the other people who are in the environmental program very active was Harvey Checkaway and Steve Wing. And shortly after I got here, the Occupational Health Studies program started work on the rubber study. They studied the rubber industry, and Bob Harris was the head of that program. And after a while, he kind of left that program, and I became head of the Occupational Health Studies program. And we continued some of the work with the rubber study, but then we got a very large contract with Oak Ridge National Laboratory to study the effects of radiation on all of the workers who were involved in the atomic industry.
The Oak Ridge National.
Oak Ridge, and well, we studied people at other places, all of them who are in the Department of Energy laboratories.
And Steve Wing worked with you.
Steve Wing, Harvey Checkaway, and Steve Wing worked with us on that. Yeah. So.
And you taught in Epi 160, didn't you?
I did, yeah. Well, of course, John Castle was teaching 160 when I first came here. And he
But
gave,
you ran a lab, didn't you?
yeah, we had, that's right. John Castle gave the lectures, and his lectures were outstanding. You know that? Well, you have copies of the lectures, and I read the first one recently, and want to see some of the others. But he would then divide up the class into smaller groups, and various faculty would meet with the smaller groups. But then after he retired or left the department, then
Abdul Omran. Didn't Abdul take it over?
Omran took over and was the lecturer. And then for 1 year, I and Gerardo Heiss and a couple other faculty were doing Epi 160.
For the majors, wasn't it?
No, that was for the whole, for the School of Public Health.
Ah.
Yeah.
Oh, then maybe I missed out on, because I don't know when John last did it, but he passed away in '76. I took it in '77.
Oh, you did? Okay.
And Abdul Omrad was giving the lectures. And then in '78, Abdul was giving the lectures and I was a TA.
Okay.
And then we didn't have the faculty, the labs were led by faculty previously, but then it was the TAs who did that.
Took over, yeah.
And then I know you got back into it later with Al Tyroler, but that was quite a bit later after Abdul left.
After Abdul left, yes. We had it for just a year or two, and then I don't remember who took over at that point.
Well, there was a succession of people. I think Meg McCann.
That's right.
Did it with Steve Wing, I think.
Steve Wing, that's right.
And they did it for a while, and then I have the later history written out. But let's come back to the earlier part, because I'm trying to be sure we can reconstruct that. So was Abdul here when you came already?
He was here, yes,
okay.
That's right. I forgot about that. He was here, yes.
And can you say anything about John Castle, working with him, what he was like? Because
well, John, was always had a great deal of breadth in his thinking. Epidemiology for him was the total society, total, social, occupational, infectious disease, and it was wonderful just to be associated with him because of his breadth and his stimulation. But I was new here, and so I didn't have that much contact with him, or didn't have the opportunity to really appreciate the breadth that he had. So,
what was it like to work for him? Was he a good supervisor?
He was a very accommodating person, very thoughtful. The one thing I remember about John Castle was, he had to leave the department because of his illness, and his house wasn't too far away from ours. And I would pass by, and there he was out in the yard on his hands and knees. He was weeding. He was an avid gardener, and even though he was so sick, he was out there doing his gardening, enjoying what he could enjoy, up to the last, really. Yeah. And that was characteristic of him.
Well, I was wondering, so I know that Michelle Abraham wrote an article about him. Did he have a South African accent?
No, not that I, certainly not particularly noticeable.
Yeah.
No.
I don't know if there are any recordings.
You remember Cecil Sloan was from South Africa too, and he also, I didn't detect any accent in his, because they do speak English there.
Yeah.
Well, John's, from what I remember, because I took his lectures, I was there, he spoke in a very distinguished manner, and he didn't have an accent, but it was not American English, it was...
Yeah, it was more like a little bit of British English. Yeah. Very, very articulate, very clear pronunciation.
And precise.
That was the emphasis, so he really was a strong proponent of the population perspective. And
John Castlemore, yes, very, very strong. Yes. And of one of his, I think, most inspiring articles is that one he wrote on, I can't remember the title of it, but it was...
Host resistance, the social environment and host resistance.
Yes, yes.
As Bert calls it, his valedictory article.
Yeah. That was an inspiring article.
He was also mindful of clinical epidemiology too, though, even then before it had become as high profile as it is now. I know I came across something he wrote on psychiatric epidemiology. Anyway, I don't mind to distract from the flow of the interview, so let you take over again.
Well, I guess I was just curious, so when John was chair, if Like, did he sort of encourage collaborations across the school?
Oh, definitely, yeah. We had a lot of collaborations going with not only other departments, but with the School of Medicine. We had some people in medicine who were very strongly committed to clinical epidemiology. Tim Carey.
Oh yeah, he's the head of the Shep Center now.
Well, of course, that was that was after John Castle, because Tim Carey was a student of mine.
Yeah.
I'm a little bit out of order now, but I remember actually before I got involved teaching Epi 168, when I came in '77, Abdul Omran led the course, and Michelle Ibrahim led a lab for the Epi majors, who actually didn't go to Abdul's lectures after the first couple. And then I can't remember what happened the following year, but the year after that, I think you and Gerardo taught an it was an Epi-Bios version of the class. Do you remember that?
No, I do not remember that. For the Epi majors?
For the Epi majors. They didn't go to the lectures in the auditorium. And then the following year was when Epi was it when Epi? No, it was before Epi 168, because I remember being a TA in it. And it was you and Michelle, I think. And then at the time of the grading, you were off in Europe.
Okay.
And so I was doing the grading with Michelle.
Okay,
or I was
right.
doing the grading and Michelle was looking over my shoulders. And I remember we did something, did something that ended up involving you in some appeal. And I don't remember which year that was.
One of my distractions, or the reason I was actually brought to the university, was to head up the new Institute for Environmental Studies. And it was Dan Oken who brought me here for that. And so I had to do other things besides epidemiology. I had to try to both bring together environmental groups on this campus and also on the North Carolina State campus. So I used to have seminars and meetings between our different organizations, even between different schools.
Is that when you also got involved with the textile research?
No, that I only was a advisor to Jim Merchant, whose doctoral dissertation was on the cotton industry. And that's the only real involvement I had with the textile industry. We did some studies on asbestos in the asbestos textile industry, but not very extensively. So I really didn't have much involvement in textiles. I was teaching occupational environmental epidemiology here in the School of Public Health, and Steve Wing and Harvey Checkway and I used to together teach those courses.
That was 162, was that right? Remember?
I don't remember that number. Yeah.
So you're doing so many different things, and also teaching that class and the Epi 600 or 160 at the time.
Now, Epi 160, when sometime around, let's see, somewhere around 1990, I began to think about ways to conduct a class without a lot of lectures to get more student involvement. So I went over to the University Center for Teaching and Learning, and I started to ask them, what are some possible approaches? And they started talking to me about interactive learning and involvement of students. And that's when Lorraine Alexander and I started thinking about, having courses where there could be more student-led discussions and students working on problems without having much in the way of lectures, but let the textbook be the lecturer. Let them read the textbook, and then let's develop problems and exercises for them to apply what they've read in the textbook into some practical, applications of it all. And so it was about that time that the school started thinking about online courses and off-campus courses. So with much of Lorraine's input, we started developing courses that could be put on online and interactive with students working out problems, and in class where they'd have a problem, they'd have to discuss among each other their approaches to the problem. And the problems were something, you know, like sometimes a journal article, and we would give them a set of questions about the journal article. How could they interpret what the article was doing? What are some of the possible alternate conclusions from what the authors drew, and so forth. Some of the articles, some of the exercises we got from CDC that they used in their own training of their epidemic intelligence service officers. So I think it worked out quite well. We were able to engage students in an active learning rather than lectures. What impressed me one time is when I had asked to give a lecture at the medical school. And there were all these students there, and in the back row there were students with newspapers. During the lecture, you know, they were reading newspapers. And I was thinking to myself, they don't have to be here. You know, what's the sense of them being here? And what's the sense of a lecture if they're not going to listen? Or, you know, if they're not. I don't know if they're getting anything out of it. Obviously, they're reading a newspaper, they're not getting out of it. So that was some of the things that were stimulating me to think about alternatives to lecturing, even in basic courses.
Well, I remember that you gave a lecture in the Epi 160 when I was a student in it back in '77. I thought your lecture was terrific. It seemed to me I learned a lot from it, so when you used to go later saying, nobody learns anything from a lecture.
Well, they learn
strange.
From it. But you know how it is. You can, when you're attending a lecture, after about 10 minutes, your mind starts drifting, or you're in and out of attention. The more colorful a teacher is, of course, you're paying closer attention, but not everybody can be a great actor or comedian.
Well, your lecture was very clear and it was very organized, and but I mean, you were a real pioneer in the way you developed Epi 160. I remember that Barbara asked you and Al Tyroler and Bert to teach it one time, and Al wasn't all that excited about it, and then Bert got put into the distance course, which at the time consisted in flying out to some other place in North Carolina, and then you inherited you took over the classroom one.
Yeah, he and I did that together for a while. We used to fly to Charlotte to give let's see, it was an introductory epidemiology course for people with the health policy program.
It was their executive master's program, wasn't it?
Executive master's program.
I mean, which we do with internet now, and that's thanks to you. I mean, it was you who rescued the department rescued at least one faculty member from having to fly around the state on the AHEC plane in the early morning hours to teach this class. And I remember you really pioneered that online. I remember you asked me once to give a lecture in the conference room, and it was on live. Somehow video, I guess the telephone hookup or something. And then there was one from the Mays Center. I remember you. The
Mays Center, we were at that time trying out live streaming of lectures, and then we actually could have people ask questions.
Yeah, there were folks at CDC, I think, who were asking questions, and somewhere else, and it was pretty wild. And you got all that. I mean, you were the one who was leading all that. It was nobody else in the department.
I was participating. I wouldn't say I was leading it.
Well, you had me doing it, so you led me.
But without Lorraine's input, you know, I could never have done that, because she really developed the technical skills to put this all on web and in an interactive way. And she's been a resource for the school for all these years.
Yeah. She's actually going to come a little later when Karin has to leave, so maybe we'll tell her that again when she's here to hear it, because I would agree. Do you have anything on your outline that you want to go to now? I've steered us away again.
Yeah, there was one thing I wanted to ask you about that you know, sort of, I mean, still talking about Epi 160, but that you also, is that true, you involved sort of adjunct faculty to come occasionally?
Oh, yeah.
And
yeah, in the early years of Epi 160 for the students in the School of Public Health who are not Epi majors, one year we actually had the final exam as an oral exam where the students were given a journal article and they came in and we queried them about their understanding of the journal article. And
how'd that work?
Well, it was kind of enjoyable for us, but some students were very intimidated by having to come in, and there were 3 faculty, so they would come in, it was almost like coming before a police board.
Tribunal. It's in the conference room, right?
In the conference room.
I remember watching.
So, but we did it for all the students, but then we decided, gee, this is a little bit too much. So
there were 100-something students in the class then.
So we decided to break up the class and let groups of people give their presentations to adjunct faculty. So we had about 7 or 8 adjunct faculty who were coming in, and the students in small groups would appear before them and give their group presentation on a couple journal articles. And the adjunct faculty would then question them about it. That worked out fairly well, except it was a real headache trying to get, 8 adjunct faculty to come in at the right time. And it's also difficult for adjunct faculty to come here, It's not as if they can park out in front. So all those things were fun to do, but to do them year after year was just a little too much. It was a good way to involve the adjunct faculty, though.
Mm-hmm.
They really were part of the grading process. They were interacting with the students.
So I guess another question was, so you were talking about what it was like in the 70s, but how about like in the 80s and 90s in the department here? Like who I guess you mentioned a few people that you worked with. Were there others, both inside in the department and then other types of collaborations?
Well, in the 80s I was no longer running the Institute for Environmental Studies. I went to Australia for a year sabbatical, pretty much because Michelle Ibrahim told me they wanted somebody in Australia to run a clinical epidemiology program in one of the hospitals there. There was a Canadian who was running that program, and then he left. And so Michelle somehow knew the people down there, and he asked me if I was interested. Well, it sounded pretty good, going to Australia for a year. So I did go to Australia in 1980 and had 1 year as a faculty member at the University of Sydney, had called it the Commonwealth School of Public Health. And I taught a basic epidemiology course there. And I enjoyed that a lot. The Australian students were used to very English-style lecturing, and we had a lot of hours in school listening to lectures. And I came in with this course where we broke up into groups. We got journal articles to discuss, and they loved it. And I had a lot of fun with them. I also had met with groups, small groups of students to talk about their theses and dissertations that they were undertaking. So that was a good experience, And we were in Sydney, Australia. We actually got an apartment that looked under the Sydney Harbour Bridge right to the Sydney Opera House. you know.
Wow.
It was a beautiful sight. There used to be ships, a lot of freighters coming under the Sydney Harbor Bridge, more or less past our apartment, going
Wow.
inland to unload.
Wow.
And at night, you'd see these ships. So it was a real enjoyable experience for my family and for us, for myself professionally. So,
And you also worked with IARC in France?
yeah, I did. They have these evaluations of chemicals for potential carcinogenesis. And so they would periodically have a fairly sizable group of scientists from different disciplines get together to review the literature and discuss whether it was time to draw some conclusions about the carcinogenicity of a specific chemical, you know, asbestos, chromium, fluorides, you know. So I went there that was Agency for Cancer Research, International Agency for Cancer Research is in Lyon, France. And that's where we would meet for about 8 days. And we would actually write up a monograph on the evidence for or against the carcinogenicity of this particular chemical. A couple of those meetings I chaired, and I was in about 5 or 6 of them. But it was a very interesting experience because there were people who were chemists, there were basic scientists in biology, epidemiologists, some physicians,